Okay, so hello everyone. In today's Psych Talks session, we are with our guest speaker, Dr. Fathimunissa. It's a pleasure to have you here, ma'am.
Thank you so much for the invitation, Arshia. It's my pleasure.
Yeah. So, giving a brief introduction, she is a consultant in reproductive medicine, obstetrics, and gynecology. She is the director of Fatima IVF Fertility and Women's Center in Chennai, and she has a vast experience of 15 years in infertility, high risk obstetrics, and gynecology cases. Uh, I think this will be an enlightening session for all of us. So, the stage is all yours, ma'am.
Thank you, Arshia. So, are you going to ask me any questions, or can I just start?
You can start, ma'am.
Okay. So, I think because this talk we are only going to talk about infertility and fertility now. So, I would like to begin by, what is infertility and what is the incidence of it now in the current scenario, and is it on the rise? Because that is what was your question to me earlier. So, infertility is we term a couple to be infertile or suffering from infertility if they are unable to conceive after trying for one whole year. And here we have to be very, where the way we define it is that if they've had regular unprotected intercourse, regular as in there is no exact definition for it, but we in as doctors we say that if they are having an intercourse at least thrice a week unprotected, so not using any contraception, and if they have tried for 1 year and if they have not conceived, that's when we call it infertility. So, and then there are two types of infertility. So there is primary infertility and secondary infertility. So primary infertility is when a couple has never conceived, and secondary infertility is when they have conceived at least once before, no matter what the outcome. The pregnancy could have been a miscarriage or they could have had a live birth, whatever the outcome, but they have conceived previously but are struggling to conceive right now. So, this is what is the definition of infertility. So, what is the incidence of infertility? If you see, you overall, the incidence has been around, say, 5 to 10%. Okay, and we would like to believe that primary infertility is more, but let me tell you, even secondary infertility is so much more than primary infertility, actually speaking. It's just that not many couples, after, because they have a child, they try and it doesn't work out and they don't come out and they don't approach the doctors and they're okay, they're happy and satisfied with one child. So we don't see that many couples approaching for treatment, but yes, the secondary infertility is also on the rise. Now, what is the reason why infertility happens? There are lots of medical factors, and but why is it on the rise now is what the question you had for me. So yes, globally we are seeing more infertile couples now, and there is not a single cause for it. I would say it is multifactorial. It is probably has a mix of environmental factors, societal factors, lifestyle changes, and also biological factors. So current scenario is that we have women especially, they are focusing more on career, so the marriages are late, they want to delay childbearing. So we all know that age is the prime factor. So if as the woman's age advances, the chances of conception keeps on coming down because the number of eggs that we say and also the quality of eggs, so all of this starts declining. So the best time to conceive, if you ask me, is in your 20s, and once you hit the 30, and the fertility starts declining, and once it's you 35, you hit 35, then there's a rapid decline in your fertility rate because the number of eggs and the quality is coming down. So that is one more reason I would say that couples are facing, and also lifestyle changes is a major factor. So we have metabolic disorders, we have obesity, we have diabetes, we have PCOS. There are so many contributing factors, and our lifestyle mostly sedentary. We are not as active as probably our parents were or our grandparents were, and all these things are contributing to PCOS and a lot of other things. Even not just for the female, I'm also talking for the man. The sperm quality, with obesity, the sperm quality does decline, and then there are a lot of other factors like smoking and alcohol and poor sleep, late sleep, all of that factors, night shifts, so many things, the stress that contributes. So all of these factors, and apart from this, if you take environmentally, there's so much pollution. There's you must have heard of something called endocrine disrupting chemicals, EDCs we call them, or microplastics. So these things exist in our, things that we use on a daily basis. And there is a lot of eating from outside, and a lot of unhealthy food that's going in, a lot of cosmetics that we use. So all of these have these disrupt your endocrine mechanism, your hormones, and this in turn can lead to infertility. And also, if you take, like I already said, delayed childbearing, so societal factors. So all this, and there's more awareness. So there are more couples who are approaching, because I do see a few patients who have not done anything for 25 years or 30 years. They would be 50 when they come. And when I ask them why you did not go to a doctor, and they don't know that they should have approached. So they kept trying and it didn't happen and they waited. But currently it is not so. So there are more patients that are reporting, and so the data is more, there is more number. So all of these factors are responsible for a global rise in infertility. That's what.
With this, I have a question now. So, many people say that does stress cause infertility, or it's a backward thing, like infertility is caused by stress. So, what is the scenario?
Okay. So stress, I would not say directly causes infertility. So there is, but of course it is contributory, because when stress levels are high, there is some, hormonal disruption that there is, and it is going to affect, when you're stressed, it's going to affect your sleep. Okay, so there is a hormone, a sleep-inducing hormone, which is melatonin, which has a role in fertility, in improving your fertility. So if you're not going to sleep, then that is going to be disrupted. So there are small, small things which stress can, indirectly have an influence. And if I say that, yes, stress can cause a lot of overeating, eating disorders. So you're going to have some weight gain. If you're going to be falling in that trend, then that can in turn lead to maybe exacerbation of PCOS, or poor sperm quality. So this way, indirectly, stress can affect infertility factors. And also, whether infertility causes stress, there is no doubt about it at all. So when, every month it's a struggle. So many couples who come to me, they say that the month starts with hope, and then there's heartbreak. Again, it starts with hope, there is heartbreak, and they're undergoing so much of stress. And there's not just that, it is also, our society here, especially in India, it's still a taboo. If you don't have a child, you are an outcast in many cultures still. You're not allowed to attend, family gatherings. It's kind of like you're not a good, there's something wrong with you as a person. So they have that guilt, they have that shame, and they feel less of a man or less of a woman. So all this definitely is very, very stressful. So I think it works either ways: stress causing infertility, infertility causing stress. It goes hand in hand. I think as a society, especially here in India, I think we should make them feel supported and make them feel, if they don't want to talk about it, you don't have, it's none of your business to go and poke your nose and ask, why, well, when is the good news? If it happens, they're going to tell you any which way. So
This is the
a lot
first
of
question
couples,
that we get soon after marriage. After 10 days
exactly.
of marriage, everybody starts asking.
Exactly, exactly. So I think as a society, we need to evolve, because most of the couples who come to me, some of them, they have tried for so long, and they've tried everything. It's not worked. Even IVFs have not worked, and they actually are okay with, being childless, but they want a child only for the society. They're like, because all these people have been asking me, I need to prove it to them. So I tell them that, you want to have a child, if have it for yourselves. If both of you want it, you go that extra mile, and because you have tried everything. It is not your mistake if it didn't happen. Somebody has a child, it's not that they have done something great. It's God has given it to them, and it's unfortunately not happening to you. So but they're like, no, we just have to prove it. And I've had one couple last year, and they come from a village side, and they have been outcasted. So they stay right outside the village. They're not allowed to come inside. And if nobody crosses their place, and if they cross somebody's house, then they are being abused. And so when she came, she said, ma'am, and they're not very well off either. So they were struggling with money. And they've still tried, and they stayed here. She conceived twins with me, and she stayed here for the entire 9 months. I said, why are you spending so much and staying here if it's difficult? You can continue your pregnancy at your home place. So she's like, no, if I walk into my village, I will walk in only with my children. So because I need all of them to close their mouth, I need to prove it. So that is the kind of mentality that that's probably because of the society, and I think we should stop doing that. We should evolve, and we should just give them their space. I think also one more thing which is there abroad and doesn't exist here is, there are support groups. So like-minded people who are going through the same problems. So they have support groups where they discuss, and they're there for each other. They're helping them emotionally and all of that. But that doesn't exist here because it's still a taboo. When couples come, they don't even want their parents to know that they have they're going through a treatment, because yet again, and if they conceive, then there are people saying all sorts of things. So I think that we as a society should evolve and change and just keep our noses out of their business. And when they conceive, yes, you bless them. If whatever they're going through, you don't know. So that is my request to everyone.
So we find some girls, young girls, like teenage girls, who are having PCOS. So they have a fear that in future will they have infertility. So what is the percentage of infertility in such cases?
Okay, so teenage PCOS doesn't directly mean that they're going to have fertility problems in future. So automatically doesn't become they don't become infertile or anything like that. And also we have to be very careful in diagnosing PCOS in teenage girls, because it could just be a normal puberty. Because when they start having their periods, it could be for a couple of years. It could be irregular because their HPO axis is what we call. So that is just maturing. Okay, so they may not have regular cycles, and a lot of mothers who come very concerned that maybe she's having polycystic ovaries. But and also when we do ultrasound for these girls, we have to be very careful because their ovaries are very young. They have a lot of eggs, so it may give a picture of a polycystic ovary, but it may not be. So they may not have a PCOS as such. So diagnosing the right diagnosis is very important. And secondary, what we have to focus at this stage is a healthy weight, exercise, some kind of sport. So keep your girls active. Okay, give them the right kind of food, because there's so much out there now. And most of the young teens, they are on their phones, and they're all indoors. They don't play outdoors, and they don't do sports, and their eating habits are not right, and they also have exams. They have stress related to that. So healthy weight, maintaining that, and having a good active lifestyle is what I would recommend at that stage. Of course, beyond that, if there are issues, I think you should definitely get an opinion from a gynecologist. But doesn't automatically mean that they're going to have infertility issues. Maybe some of them may, and they may need a bit of help. Most of them may just not have any issues in future and conceive normally.
So, going about IVF, is egg freezing a good option for new age working couples?
Okay, so when it comes to egg freezing, there are two types. Okay, so as in based on the indication. So are we going to freeze eggs for any medical indication, or is it going to be a social indication? So I think you've been asking about the social oocyte freezing. So medical indications usually are for someone who is suffering from some type of cancer, and if they're going to undergo a chemotherapy or a radiotherapy, which is going to damage their eggs. So then we tell them it's not just for eggs. I will also talk about the sperms. For them, sperm freezing or egg freezing earlier on is definitely recommended. Now, coming to social oocyte freezing. So, social oocyte freezing is a recent thing, and there is a lot of debate on it because it's very controversial whether we should, promote it or not. So, I'm not here to debate on that, whether to promote it or not. But yes, for someone who's everybody is very focused right now. So there are some young girls who come to me, some women in their 20s, even married or unmarried, they come to me and then they say that I don't want to get married at this point, or I'm married and I do not want a child for the next 5 years. And I'm very clear about it. I'm already 28 or I'm already 30. Okay, and but I don't want my chances to reduce in future. So I want to go ahead with a egg freezing. So yes, it is legal and it can be done. Okay, but is there a guarantee that if you're going to freeze your eggs, you're going to definitely conceive in future with that? No, that there's no guarantee for that. Of course, your chances will be better if you freeze, because you're going to freeze your eggs at in your late 20s or your early 30s, and if you're going to come back after 5 years or so, where your egg quality at that point in time is going to be low, your egg number is going to be low. So of course, the eggs that you have frozen back then can be helpful, but it's not a sure shot. That is something I want to stress. And so it is an option, it is a viable option. But in my opinion, always finishing your, like I already told you, your best reproductive age is in your 20s. Okay, especially actually your early 20s, but of course, at least till your 30 is the best time. But if you are very sure that for your career or because you have not found a partner or for whatever reasons, you want to delay childbearing, then definitely social oocyte freezing is a good option for you. But it is expensive, and it is not 100% guarantee. It's something you should keep in mind. And sperm freezing, yes, yet again, sperm freezing, we don't do it for delayed childbearing, but for medical reasons, where if the person is having some kind of cancer and he's going to undergo therapy, then freezing sperms is definitely an option as well.
So, which one has a higher success rate, fresh or frozen embryos in cases of IVF?
Okay. So when we go for embryo transfer, fresh as in is just for the audience to understand. So fresh transfer, we mean the same month when we get the eggs out, we do the IVF and the embryos are in culture, and then we just transfer them back into the uterus. So that is called a fresh transfer. A frozen transfer is when we keep the embryos in culture, and maybe on the fourth or the fifth day, we are going to freeze those embryos. Now they're going to stay in that state. You can even freeze it up to 10 years, and later on, in a subsequent cycle, maybe after 2 months or whenever they want the transfer, even after 6 months, or even sometimes after a few years when they want a second child. So we can thaw these embryos, unfreeze them, and then we can put them back inside the uterus. So this is the difference between a fresh and a frozen transfer. Now, why do we do a fresh or a frozen transfer? Is there are certain indications. Success rate wise, overall success rate, there are studies to say that there is not much of a difference. But yes, there are few studies which say that frozen embryo transfer has a slight edge over the fresh transfer. Because during the fresh transfer, that is the month the woman has undergone a lot of injections, hormone injections, and her hormone levels are quite high. So they will. Some studies say that the uterine receptivity, the lining, the endometrial lining, may not be as receptive. So the chances of success may be slightly low. And frozen embryo transfer, they have found that the chances of a low birth weight or a preterm delivery is low. The live birth rate chances are little higher than the fresh transfer. And mainly why this frozen embryo transfer people started doing it is for women who have polycystic ovaries, and they usually tend to hyperstimulate when we give them these hormone injections. They tend to hyperstimulate, and then in that condition, doing an embryo transfer, and if they conceive, the chances of this conditioning worsening is more. So that is why for women who have OHSS, we definitely recommend a frozen embryo transfer. And so saying that there's not much of a difference, but most clinics now, prefer to do a frozen embryo transfer.
So, do couples really expect a donor, or they opt for their own like cells for the IVF procedure?
Okay. So most of the couples, 99.9%, or rather, I would say everyone who comes wants their own. So everybody wants their own offspring, their own gametes to be used. So donor, yes, there are certain indications where we, offer them a donor gamete, whether being a donor egg or a donor sperm or both. So that is when they have been unable to conceive with their own gametes after probably multiple, IVFs have been tried, or they have where their own gametes cannot be used. So if the woman has had a premature ovarian failure, where there are no active eggs left for her and she stopped menstruating, so there are no eggs to go through this procedure, then yes, we tell them to go for a donor egg. And for a man who does not have any sperms, who's got a severe we say oligoasthenoteratozoospermia, or he has an azoospermia where there are absolutely no sperms, and even maybe a surgical retrieval of sperms has been tried and it has not worked. So for them, we would suggest a donor sperm. So these are the few places where we offer them to go for donor. But yet again, it is completely their decision whether they want to accept it or not. And there are a lot of, most of the couples do not opt for it in the first go. Even after failures, they still want their own, they want to try more. But eventually, this is a last option which can be tried. It is legal, and it is all done through, we go through registered ART banks and all of that. So it is legally, it can be done. It's not a problem, but the couple have to decide and they have to tell us. They have to be, both of them have to be willing. There are a lot of taboos attached to it, and they have a lot of doubts, and the families may not accept, and a lot of things like that. But it is a very confidential thing. So from the ART clinic where they're operating, this information is only discussed with the couple, not even to the next of their kin. So yes, but not everybody wants to go, and definitely not in the first time. Then nobody wants, everybody wants their own, and they don't want to go for donor gametes.
And so is the success rate too. If the female or the male is not able to conceive, and if they opt for donor, depending upon the condition, the success rate also varies.
Yes, so the success rate, if you ask me, it does not automatically mean there's going to be 100% guarantee. So when a lot of couples misunderstand that, we tell them that okay, your gametes are not working or you don't have, so we are going to go. So then they think okay, so now it's going to be 100% guarantee. So that is not how it works. Of course, the success rate is going to be higher because we're going to be choosing a donor who's going to probably be relatively younger, and who's got healthier eggs, and good sperms, and does not have any infertility issue in her life, and she's got a normal child. So that is the way we choose. And but still, when it comes to IVF, it is, no matter how much science has advanced, it is not 100% guarantee. So there are a lot of factors which determine the success. So that is something I would want to put across, because they have this misconception that okay, now that we're going for donor, then it's all set and it's done. But definitely, comparatively, donor cycles, the success rate is relatively better.
So, what are the percentage of cases in concerning only secondary infertility, and what can be the best resolution for them?
Okay, so secondary infertility, like we already spoke, it is much more prevalent than what we can actually think. So at least 1 in 10 couples do have secondary infertility. That is what the data says. And like I told you, secondary infertility, it could be, it is like, if the woman has conceived at least once, and then she's unable to conceive, no matter what the outcome, whether she has a child or it was a miscarriage or it was an ectopic pregnancy, but and then subsequently she's not able to conceive, is when we term them secondary infertility. Now, whether it is only because of the woman, no. Infertility is always, contribution, equal contribution from both couples. So it could be a problem with the woman or the man or both. And so when they've conceived once, we automatically think that, that's it, I've conceived once, so I'm never going to have a problem in future to conceive. But it's not so. There could be certain things that develop as time goes. So when you conceived first, maybe you were younger, so your age is declining, and the, like I've already, we know the age related decline, whether in egg quality or sperm quality and egg number. So that could be contributory. So there could have been some new tubal factors, like secondary to some infection, or maybe post your delivery. There could be a tubal block which is not allowing you to conceive, and there will be weight gain post. All of them, I mean, all mothers gain weight, and you may not have been able to lose weight post your first pregnancy. So that can contribute, that can cause a new, progression of a PCOS that is already there. So you may have problems with your cycles. Your husband, yet again, any lifestyle factors. If these develop something, then the sperm quality, the number that could have been, declined. So there are a lot of factors which could be there. So an evaluation is the first thing. So we have to find out what is the reason this is not happening, and then accordingly give the treatment. And of course, the treatment options are varied. It could be what the couple wants, because they already have a child. They may not want to go immediately for an IVF for the extra length. They want to try something simple. Doesn't work out, they're okay. It works out great. And there are certain couples who are like, no, we definitely want no matter what. So they're okay with going for IVF. So it doesn't have to be an IVF in the beginning itself, or that is not the only option. So you start first with an evaluation, find out what the issue is. If it is going to be lifestyle issues, then you try to correct that. If it is going to be weight gain that is contributing, then focus on that, improve your lifestyle. So, and try something simple, just like a follicular study. And based on how it is what your doctor suggests and what you want to do, you can take it forward. So secondary infertility is also there, and then yet again, not many couples don't want to even meet the doctor or find out, because they have been trying, but they already have a child, they are satisfied. If it happens, they're okay. If it doesn't happen, they're okay. So not many people approach also. So the actual incidence of secondary infertility, we don't know. Okay, so there are many couples who have a single child. We don't know if it is by choice or it's because they have a problem. So that is what. So the resolution is depends upon what the issue is.
So let me just check if I have further questions. Okay. I don't think we have any more questions. With this, I think we can end up the session. Yeah.
Thank you,
So
Arshia. I hope
thank you so much. Yeah.
I I was able to throw some light on this and create
Yeah,
some
I would.
awareness.
I would be thankful for you to join and give us insight about all these things. And people who are new to this channel, like, share, and subscribe. Thank you so much for your precious time, ma'am. It's a pleasure to have you here, and we
Thank
hope
you. The
that we'll
pleasure
have
is mine.
future sessions like this in future as well.
Definitely. Thank you so much. Thank you.